Women have been giving birth for centuries, so it's a pretty natural experience, right? Wrong. I'm Stephanie King, professional doula, childbirth educator, and the creator of the My Essential Birth course, the online childbirth education course that's helping women everywhere confidently achieve their best birth. Today's culture would have us think that birth should be treated like an illness or an emergency, and that most of us need other people telling us what's best for our bodies because we aren't the experts. So sit tight, because if you're tuning into this podcast, you'll probably start to believe in your body, your intuition, and find yourself empowered and confident to do what it takes to have the birth of your dreams. If you like listening to me take you through these weekly topics step by step, then you're going to love the My Essential Birth course. Make sure that you're subscribed to the podcast, and definitely head over to myessentialbirth.com for the free downloads mentioned right here in these episodes, and to join the birth course and community full of pregnant moms just like you. I have to add a disclaimer that I am not a medical professional and I cannot provide medical advice. All of the information expressed in this podcast are based off of personal, professional, and educational experiences and are my own opinions. Please work with a provider you trust for medical advice during your pregnancy and birth. NSITT95 is our reviewer of the week. She says pediatric/prenatal chiropractor and first-time mom. I found this podcast when I was about 12 weeks pregnant and binged so many episodes. This podcast gave me enough information that I was able to recall advice and birth stories and feel confident to listen to my body while having contractions at 33 weeks pregnant and realizing this was it. My baby was ready to meet me earthside and wanted to celebrate Mother's Day with me. I've only read birth plans with my husband over short conversations, no details. I was able to get through labor with confidence because I was able to remember the stages of labor. This podcast is a all caps must have. I'm so thankful I found this podcast and that you put so much effort into giving great information, advice, and making everything about pregnancy and labor relatable. I give so much credit to my confidence to this podcast. Thank you so much for changing my life and helping me welcome my sweet baby girl into this world. Thank you so much for that incredible review. I am super happy. It sounds like things are going well postpartum. This was a pretty positive, even though you had your baby at 33 weeks. Sounds like that you're in a good, positive place. So that's really, really happy. I'm happy for you guys. Also, Mother's Day. Yes, I have a Mother's Day baby myself, and it's quite honestly the best. So I can't think of a better gift to get on Mother's Day. Absolutely wonderful. Also, I kind of love that this podcast is going to match up with what you were talking about, even though you didn't call it what it was. And that is preterm labor. So I asked you guys on Instagram recently, I said, give me your topic ideas. What do you guys want to hear about? Preterm labor came up, and I thought this is something that we need to chat about. I don't know that I've really gone into this a ton. Certainly it does not have its own podcast episode yet as a topic. So here we are. Along with that, I asked you guys questions. I said, give me your very detailed questions that you have in regards to preterm labor. So if you answered that question box on Instagram recently, the week that we put this up, it's going to be answered here. That's just fun that I get to talk to you guys. Like, this is my way to communicate with you, just back and forth. So this is going to be kind of like everything that you can imagine about preterm labor. Not really everything, but I want to go through, like, what is it? Maybe who's at risk for it? Kind of what the symptoms are. What can I do if I find out I have it? And then making sure that I'm answering your questions as well. So let's talk about what it is. Preterm labor is sometimes called premature labor, and I'm talking labor right now, not talking birth. So I'll get into that in just a moment, but just to be clear, so you can follow along with me, this is, you are having preterm labor, you are having real contractions anytime after 20 weeks, but before 37 weeks. So we say 36 weeks is that like full term. They're saying 37 is that safe full term, particularly when we're talking preterm labor. But your baby is fully developed, right? That like 36 weeks plus, but for safety and just because honestly, they need more time in there. It's 37 plus, and they keep an eye on it even after that. But early preterm labor is any time after 20 weeks, but before 33 weeks. So preterm labor can fall within any of those, 20 weeks to 37. We're talking early. So that would be after 20 weeks, but before 33 weeks. Late preterm labor is that 34 to 36 week area. So right when you're on the cusp of things are going to be okay if I have this baby and we probably won't have any NICU time, right on the cusp right there. And some babies that are born 34, 35, 36 week, they just thrive and they don't need time in the NICU. And sometimes they do. So it'll just depend on your specific situation. And that would be for the actual birth. But okay, so how often does this occur? That it's going to be every 1 to 10 births in the United States. That is how often preterm labor occurs. And obviously, as we're talking preterm labor, and I probably confused it as I was talking about like when people give birth and not, but it can lead to preterm birth. So keeping that in mind, that not all preterm labor leads to preterm birth. And so, yeah, the goal obviously then would be to make sure that we are stopping that labor from continuing on until mom is at that 37-week mark. So if you come in at 37 weeks and you're having any kind of labor contractions, chances are they're not going to try and stop it. They're going to prepare you to be able to have a baby. But if you are before that, they're probably going to take some things into consideration and try to decide if this is something that needs to be stopped and what else can be done. And I'll go into that in just a minute. But let's talk about first some risk factors. That way you can kind of, not self-diagnose, that's the word that came to my mind, but so that you can kind of think of these things. And if any of these things kind of pop up as I get into symptoms, you can be like, oh, I do have a couple of these risk factors. It makes sense or not. So the specific cause of preterm labor is not known. And I also want to say here that just because you have some or several of these risk factors, it doesn't mean that you're going to experience preterm labor. So keep that in mind as well. Honestly, sometimes it happens for no apparent reason. So you can have risk factors or not. It just depends. So, but those with the greatest risks are going to be if you are pregnant with multiples, if you have a previous preterm birth. In fact, you're 2 to 3 times more likely to give birth to preterm babies in future pregnancies if you have had a preterm birth prior. So that's kind of information, again, to just have in your head. And it'll be really good for you to like think about why your previous one was preterm. Was it because you had a short cervix and maybe you could use a couple of stitches in there, which I know just sounds so fun, until it's birthing time? Are there other factors involved that you can have some kind of effect over or some kind of decision that can help the situation the next time? Or is it just you got to see what happens? Also, if you have certain uterine or cervical abnormalities, that could put you at risk as well. Lifestyle risks include long working hours and long periods of standing. So that could be anything. What comes to mind for me is like if you're a waitress or just something with like high movement. Maybe you're just up, even in an office environment, you're upstairs, downstairs, you're just kind of all over the place, a very busy person, and on your feet a lot of the time. That could be a risk. If you're someone who has little to no prenatal care, so in other words, somebody that doesn't get checked on all the normal things and other things that could be catching things that may make preterm labor more likely to occur. Somebody, if you smoke, if you're drinking alcohol or using drugs, obviously, someone who is involved in domestic violence, and that's not just the stress, that's like the physical, depending on what the violence is, a lack of social support, high levels of stress. It's interesting is that I went through and I'm reading these, what can actually cause preterm labor. And if you remember back, sorry, not to get too off topic here, but if you remember back in 2020, I had interviewed a midwife, and I'll put that in the link in the show notes. We had talked about prodromal labor specifically, which is not the same as preterm labor, but prodromal labor, like getting closer to being able to have your baby and then you're having contractions, but it doesn't lead to labor. That there was like a really high, we were noticing as doulas and midwives that there was a much higher occurrence once 2020 hit and everybody stuck inside, or there's the stress of, is my baby going to be safe in this world? We saw a lot of increase of prodromal labor. So it's interesting as they're talking about lack of social support and high levels of stress, that these are things that are out there that say, hey, this can actually be a risk factor for preterm labor. So just kind of interesting, something to keep in the back of your mind. It also says being younger than 18 years old or older than 35. And again, having these doesn't mean that you will absolutely have preterm labor. So it's just information. And then there's medical risk factors. And these are the ones that I feel like I hear about a decent amount when it comes to preterm labor. And that's things like recurring bladder or kidney infections, like especially with those, that seems to be just something that gets things stimulated and irritated and like we have this infection going on, so we've got to get baby out of here so we can take care of the infection, or however your body is working to kind of figure things out. But that's a pretty common one. If you're someone that has recurring bladder or kidney infections, that's definitely something that I've seen that does cause preterm labor. Or can potentially cause preterm labor. Urinary tract infections, vaginal infections or STDs, unexplained vaginal bleeding at 20 weeks, chronic illness such as high blood pressure, kidney disease, or diabetes. If you've had multiple first trimester abortions or any second trimester abortions, if you are underweight or overweight prior to pregnancy, remember the importance of good nutrition, good exercise, trying to do what we can for our bodies. If you have thrombophilia, which is a clotting disorder, I think we'll all agree I got through that word very well. IVF pregnancy, I'm clearly reading a list. A short time between pregnancies, meaning 6 to 9 months between birth and the beginning of your next pregnancy. And again, that does not mean you cannot have that amount of time and that it will cause premature labor. This is just like a heads up. Premature rupture of membranes. So when your amniotic sac breaks before labor begins, we call that a premature rupture of membranes. It happens in 3% of all pregnancies, but it would be a concern if it happens prior to 37 weeks, obviously. And then this is one of the questions that came from Rebecca on Instagram. And she said she was asking about a polyhydramnios diagnosis. So she said, what are the chances of labor with the polyhydramnios diagnosis? And then what's the risk of it reoccurring? Polyhydramnios is when you have too much amniotic fluid, which is kind of crazy to think that that can be a thing. That's also something I haven't talked about on here, but if you're somebody that's like measuring big or bigger at all of your appointments, then they'll probably send you for an ultrasound. This is kind of where that would pop up. Like they want to see, do you have a big baby? Are we talking gestational diabetes kind of stuff? Or like what's going on inside of the uterus? And so when they send you for that ultrasound, one of the things that they do is they check the fluid levels to tell if you're high or low or whatever. Polyhydramnios is a large amount of fluid. It is an overabundance of amniotic fluid. And there are some other things that can come along with that. It's not just preterm labor, although there is a risk for that. They also are a little bit concerned with, because baby has more space and can move more before birth, then you have that risk of they can get into all those really fun, funky positions. They worry a little bit more about the cord and that kind of stuff. But as far as it goes for preterm labor, there's about a 20% risk for moms going into preterm labor that have this condition. So kind of the next thing that I was thinking is you probably want to know how to prevent it and specific to your condition. And so if you're looking to prevent it because you have polyhydramnios, then there are a couple of things that can and may be done. And I think it's important to know that because they're not always offered or discussed. Also, there's going to be benefits and risks to both of these. So as I discuss them, make sure that you're looking into that for yourself. I'm not going to go into the details of that here in this podcast, but they have something called a reduction amniocentesis or an amnioreduction. And that's actually where they go in and drain, obviously carefully, because you don't want to break or damage the bag of waters, and there would be a risk to that. But they have the option of going in to drain some of the waters and have things kind of like sealed back up. So again, look into that. There's clearly risks involved. There can also be benefits involved. And then there is a medication that can be given to, you take it orally, but it helps. I don't know if helps is the word. It causes your baby to urinate less because remember that fluid in there, like as we feed our baby and all of that through our placenta, a lot of the fluid that's in there is it's urine from your baby. So they give, it's called I'm not going to say this right, you guys. Indomethacin, I think is what it's called, or Indocin, and it helps reduce fetal urine production and amniotic fluid production. So, or volume. So that, again, two things that you can look into. And then along with that, as far as the recurrence goes, so if you've had polyhydramnios before, are you at risk for having it again? It's rare. However, risks include the recurrence is rare. I mean, it's rare on its own, but the recurrence is rare. However, risks include gestational diabetes, any fetal abnormalities, if you're pregnant with multiples, and if you have fetal anemia, which can be caused by possible incompatible blood, kind of that Rh factor thing between you and your baby. So that answers that question for you. And again, if you're here and you're listening, Rebecca, and you have any more questions that come up because of that, just shoot us an email, hello@myessentialbirth.com, or hit me up on Instagram. Now, some of these things, I just went through this like long laundry list of like, if you have this and if you have this, and you're probably like, oh my gosh, like I may have one or two or whatever of these. Some of these you can't change, such as previous premature births, you can't change that. But other things you can. Like if you happen to be somebody who is having trouble quitting smoking, or you are drinking, those things are certainly things that you can change. And, or if you've had this prior and going into the next birth, if you're underweight or overweight, like that's something that you can work on now. So be encouraged that some of this you really do have some power over, which I think is encouraging, because some of the other things that we talk about in pregnancy, it's like, just is what it is and you got to deal with it. So let's talk about preventing and reducing your risk of having preterm labor. So to reduce your risk, and I just kind of talked about that, but maintaining a healthy weight before pregnancy is going to be really positive. Again, if you're underweight or overweight, it can be a little bit tricky. And that's for all of pregnancy. There are other things that go along with that. So obviously, we're looking at high protein, well-balanced diet, lots of water, take your prenatal vitamin, move your body for at least 20 to 30 minutes a day. That can include 2 15-minute walks, or a yoga session in the morning and a walk in the evening, however you split it up. But you should be getting your heart rate up just a touch and moving your body. Walking is really, really great. We're in summer now. Swimming is probably like the best exercise you could do. And it's going to feel so good because you're going to get that weight off your belly. The closest I've had to swimming during pregnancy was my water birth. So I have not been in climates that have been good for when I was pregnant enough to like get into a pool and feel good about it. So I can tell you from being in labor and the amount of weight that it took off that I was like, oh my gosh, I never want to leave. So if you have the ability to swim now during pregnancy and it's nice and beautiful outside, go do it. Another thing that it says is to wait at least 18 months between pregnancies. Again, heads up, I have never done this, and I did not have preterm labor. In fact, my last one, I was like, get out. So it is just information. It doesn't mean that if you do that you're going to make sure that you don't have preterm labor. So again, just information. It also talks about reducing your stress, which I think is really important to think about, but also know we do what we can. So this is kind of a common one that I feel like I'm talking to moms about, right? When we talk about relaxation practice and meditation, yes, the issue that I have saying something like this, like if you just reduce your stress, like we live busy lives, and I don't ever want you to feel like something is your fault. So even when we're talking about like weight gain and all this other stuff that I just mentioned, just know that you have the opportunity to do something about it, but I don't want you to feel bad about not being able to do it perfectly, if that makes sense. Make sure that you get treated for chronic health conditions like diabetes and high blood pressure. Again, I think that goes back to the making sure that you're having regular prenatal visits, checking in with the provider, checking in with yourself and how your body's feeling, that kind of thing. And then obviously not drinking, that's a thing. Drinking, smoking, any illegal drugs, obviously, even any prescription medication used inappropriately or even appropriately sometimes, depending on what it is and what it's used for during pregnancy. And if you have an abnormal or short cervix, or if you've had something done to your cervix that makes it so it is really open, you might hear of something called a cerclage, and this is, I'm sure, not comfortable, but they can do a couple of stitches to help that cervix stay closed so that you're not going into labor prematurely. And I do know women that have had this done and it is effective. So while absolutely not comfortable, this is a way to avoid preterm labor and keep your baby safer and in there a little bit longer. Another thing that I'm sure that you've heard, if you have come into like reading anything about preterm labor or you've experienced this at all during any of your pregnancies or have friends who have, oftentimes what has been recommended is bed rest. And so Aubrey actually asked on Instagram, she said, I've read bed rest doesn't prevent it. I'd love to know more about this. And I'm glad that you asked because we dug a little bit deeper and found some research on it actually. So ACOG actually states that bed rest is not recommended if you're at risk of preterm birth, which I kind of love to hear because it was such a common thing like, oh, preterm labor, well, let's stop her from doing everything, lay her down in the bed. That's really not always the best recommendation. In fact, it says bed rest can increase the risk of blood clots, bone weakening, and loss of muscle strength. So all things that are not great. And especially with that muscle strength, you're going to need that during labor. So let's do everything that we can to keep that. But I kind of love that. There's no evidence that it reduces the risk or lowers that risk of preterm birth. And so I think that's important for you to know, especially if it's something that is recommended by your provider. Now, on the other side of things, a provider might recommend, and that could be good for you, in the way of reducing stress and getting you some rest and all that stuff, a partial bed rest. And that would look like when you're sleeping, lie on your left side for sleeping, make sure that you're staying hydrated. Like I talked about, we're in summer and stuff here. If you are dehydrated, that causes contractions, or it can cause contractions. So making sure that you are having lots and lots of water, especially in the summer, you're getting off your feet, putting them up, that kind of stuff. But they'll want you to stay hydrated. And then when laying down, making sure that you stretch, move, wiggle, keep your blood flowing. So that could be something that is recommended. But again, it's important to have this information so that if your provider brings that up, you can have that conversation. Now let's move into signs and symptoms. That way you know what to look for. So we talked about risk factors, but how do you know if you're experiencing preterm labor, especially if you've never felt contractions before? And when it's happening so early, you might be like, oh, maybe that's a Braxton Hicks, or that's kind of a weird pain. Should I pay attention to it? So if you're aware of the signs, the hope is that you can get seen right away, contact a provider, stop labor from progressing into birth, and eventually, having a premature baby. If you're able to recognize these quickly and get help fast, that would be the goal. So here are some things to pay attention to see if you need to reach out to somebody. If you are having 5 or more contractions in an hour, so not a Braxton Hicks. And I've talked about these before, but a Braxton Hicks contraction is a tightening of the abdomen. It might even kind of pause, like you might catch your breath for a second. It might force you to pause for a moment. It's not painful in any way. You just notice the pressure, the tightening. Like if you touch your stomach, it's harder to the touch, that kind of thing. But it shouldn't be painful in any way. Now, remember with contractions, I'll explain actually some different things that you might feel that shows you it's a contraction, but they have some pain and pressure involved with them. Now, if you're having any water or fluid leaking from your vagina, obviously, and it's hard to tell. It is hard to tell sometimes during pregnancy because on top of the fact that you have increased fluids happening anyways, you also have to pee a lot and your bladder is tinier as time goes on. And a lot of times, even when women are coming up to labor, they're like, wait, did I just pee myself or was that my water? I can relate to this. That's how my first one went down. I kept getting up in the middle of the night. In fact, I had to pee a lot and I was like, wow, I'm having to pee a lot. And then I was like, man, I wonder if I'm like peeing a little bit before I get up. Anyways, I'm like, is this urine or not? And turns out mine was a very small trickle of amniotic fluid. So it can totally happen that way. The best way to be able to tell what it is to put a pad on and go for a couple hours and then see like, is the pad a little bit heavier or not? Obviously, you can smell the pad too. If it smells like urine, that would be a dead giveaway. If it's amniotic fluid, it'll smell a lot like salt water. It just kind of smells like the ocean if you've been to the ocean, but it's pretty like salt water heavy. So there you have it. But if you're having abdominal cramps with or without diarrhea, and this is where it kind of goes back to that, what does a contraction feel like, especially before it's like late term pregnancy, ready to have a baby contraction. So abdominal cramps with or without diarrhea, it can feel like menstrual cramps, which is also what beginning of contractions can totally feel like. And it can also be constant. So whereas like sometimes it might dull and come back, it can just remain this like constant irritation. Also low, dull back pain, pelvic pressure that feels like your baby is pushing down, and an increase in vaginal discharge. So those are all kind of signs and symptoms that you can pay attention to. Now, if you're experiencing any of those, here's what you do. First thing you're going to do is call your provider. You want to get your provider on the phone. If it's middle of the night, you can call your hospital or birth center and talk to the staff that's on call. Give them all the information. Make sure that you're keeping track of the things that I was just talking about, why you think you might have preterm labor, or just concerns that you have. You can speak to the on-call nurse or whoever's there. If it's during the day, you can call your provider's office and either speak with your provider or speak with a nurse or somebody there, and they will walk you through and tell you what you need to do. Same with, talking to a midwife if you're having an out-of-hospital birth. Now, in the meantime, you want to make sure that you're emptying your bladder. Lie down on your left side. You kind of want to avoid lying on your back because that can actually create some contractions. Drink several glasses of water. Make sure that you are hydrated and monitor your contractions for an hour. So you're going to be counting or noticing like that dull back pain. Does it last for a full hour? Is it coming in waves? If it's coming in waves, has it come in 5 or more of them during that hour? That's the stuff you're wanting to keep track of. Now, if those symptoms get worse or they don't go away after an hour, then you're going to call your provider back or just head into the hospital because you do want to get checked. It's obviously serious. You want to make sure that you and baby are doing okay, and so that they can take the appropriate next steps to be able to kind of stall things out if possible. So, and that's kind of the tricky part too. Like the only way to really know if you are in preterm labor is to actually have somebody check your cervix, see if there's any change, like what is happening internally. Obviously, if you're having like full-blown contractions and there's other things going on, nobody's going to have to guess. But we're hoping that you catch it early, you can get into there and get some help. So what kind of help would you be getting? Let's talk about management and treatment. So once you let your provider know that you think you're experiencing preterm labor, your provider is going to want you there. So they can hook you up to monitors. They want to be able to check your belly. They'll put those monitors on and check, is she having any contractions? They want to check on baby. How's baby doing? Making sure heart rates are good and all that kind of stuff. They're going to check your blood pressure and urine and all that stuff. But they want to see if you're having contractions. They're going to want to do a pelvic exam and see if there's some serious changes to your cervix or not. They want to test any leaking fluids and make sure that your bag of waters is intact. They'll probably do an ultrasound on baby to check their size and see how far along you are. And they might even do a transvaginal ultrasound to measure your cervix. So all things that can happen there. Now, this question actually comes from Amanda, who is one of our birth course students. But she said, I wanted to know about the interventions offered, benefits and risks of steroid injections and magnesium, as well as pushing antibiotics for GBS since it was too early to test. So I'm going to go over all that now. Those are really excellent questions and all things that would come up for you during that time. So if you're in fact experiencing preterm labor, then your provider is going to do all that they can to stop labor from progressing and to help speed up baby's development as long as mom and baby are both doing well in the event that birth is coming. So corticosteroids is something that she was asking about, like what are the benefits of steroids? Corticosteroids help speed up your baby's lung, brain, and digestive organ development. So if they know or they're concerned these contractions aren't slowing down or whatever the case, if they're concerned in any way that baby is going to be born shortly and they want to speed up some of those things so that they have a better chance of not having, of reducing any kind of complication postpartum for that baby, then they're going to do that. And that's where the steroids come in. So they're typically given if you are between 24 to 34 weeks, but they can also be given up to 36 weeks and 6 days. So remember when I talked about if you're after the 37-week mark, that they likely will not be given during that time, but it can be given up to the 36 weeks and 6 days. So that'll be, your provider will kind of talk with you about that and you guys can decide what's best for you. So if you're likely to give birth within a week, then a single course is given. It takes about 2 days after the dose to get the full effects of that, but a lot is happening and a lot of positive things are happening within that first 24 hours. It can still be a great benefit to have it just for that 24 hours. A repeat course is given if baby is still in the belly after 14 days and you're still at risk for preterm birth. So those are kind of the two options there. Side effects for corticosteroids for mom would be elevated blood sugar level. And interestingly enough, for a baby, once they are born, can actually be a lower blood sugar level that can force them kind of into the NICU for a minute too. So obviously benefits and risk both ways. You'll determine at the time which is a better benefit or risk that you're willing to take for your baby, case by case, obviously. And then there's tocolytics like magnesium. Tocolytics are to stop contractions. So magnesium would be given by an IV drop, and the goal would be to at least slow down, like, I don't know, even if you could, the goal would be to stop the contractions, but even if you can slow down the contractions so that mom can get those corticosteroids, or we can keep baby in just a little bit longer, see what the body does, and that would obviously be the best course of action there. But it could even give you time, like if you, maybe it's just for a couple hours, but you're at like a regular hospital and the baby's going to need a NICU, it could be an option just to be able to get you from one location to the next, so that you're in a better location for a baby at a better NICU or at a place that has a NICU. It can also be something that if we're slowing down the contractions for any amount of time, it gives babies, time to take in all of that medication and for those things to develop. However, this would not be given if there's no changes to your cervix. It's been decided that birth is the best option for your baby, or if labor has stopped. So if birth is imminent, then we're not going to try, like things are already moving. There's no reason to add the magnesium to it. If the labor has stopped, then obviously we don't need to stop it further. But that's the behind it, kind of what would be happening. Now, if your provider is successful at helping this preterm labor to stop, there is a possibility that they could talk about that bed rest with you. But as I talked about before, it's not necessarily recommended, or there's no studies or good information. It's not like evidence-based that bed rest is what you should be doing. So conversation to have with your provider, but know that that's something that absolutely could come up. Now, possible side effects from having the tocolytics could be chest pain with an irregular heartbeat, trouble breathing, diarrhea and nausea, low blood pressure, feeling faint or dizzy, and a headache or double vision. So keep in mind that those are some things that you may or may not have to deal with if you're experiencing preterm labor and they use something like magnesium in an IV. Now let's talk about that GBS, because I think this is a really important one to chat about, or like something that you might not be thinking about until it's in front of your face. So if labor is not able to be stopped and you haven't been tested for GBS yet, because it happens later during pregnancy, then your provider is instantly going to recommend that you have the antibiotics for GBS. So they're going to treat you as if you're GBS positive, for safety of not knowing whether or not you are. Now, the benefits of that are, if you are positive, then when your baby is born, obviously they will have received that medication should you choose to get the medication if you're positive. However, some of the risks involved with that would be that you'd be taking antibiotics for no reason if in fact you are GBS negative. Remember that it kills the good and bad bacteria. That's, I think, why a lot of moms are like, I want to know if I'm GBS positive and make a decision from there, because that can cause some issues, especially postpartum and nursing. And because it kills those bacteria, you could be looking at things like thrush and just other things that come along with it, right? Like we want to make sure that baby's immune system, mom's immune system is as healthy and good as it can be after having a baby. But that could be a reason why it's more like on the risk side of things. And then it can also affect baby's immune system for over a year. But however, right, it's one of those things. I have an entire Group B strep podcast episode actually. So I'll just link that here and you guys can go through all the nitty gritty details about GBS and all that kind of stuff. So I'll make sure to link that in the show notes for this podcast. But let's move on. Now, what happens if labor can't be stopped and my baby is born premature? That's going to be the big question that I think would be on everyone's mind next. So obviously, it's going to depend a lot on how early your baby is born and what issues present themselves once your baby is born. But a baby that's at 36 weeks when they're born is going to spend a lot less time or maybe no time in the NICU. And obviously, a little bit earlier is going to spend more time or need some things done. If your baby is born earlier, then they could be up against some possible developmental delays and health problems. So again, that'll be a conversation to have with your provider at the time if necessary. The babies that are born prior to 24 weeks have very little chance of survival. So obviously, those are the scary statistics that we don't like to talk about. And as medicine gets better and science advances, we're seeing more and more like that. The 24, like it goes lower and lower and lower, that they're actually able to save these babies and all of that. So we hope and pray that that continues, and hope and pray that whatever you're going through, that this will not be your story. However, there's the information. Those are kind of the scary statistics that I was talking about. However, I also want to say too that babies born 32 weeks plus have a very high chance of not having issues and being alive and thriving. So keep that in mind too. And those are the ones like literally no lifelong complications and all of that. It's more rare with those babies that are born 32 weeks plus. So that could be really positive for you as well. And then I think it's important to mention too that being in a hospital that has a great NICU team is going to be your best bet for care no matter what. And truly, I've heard it from literally everybody that has had to deal with NICU in any regard, that those women that are in there, women and men that work in the NICU area, are angels here on earth, that those are the cream of the crop. Those are the people that you would just want to deal with if you're having any issues, such as preterm labor or anything that puts you in the NICU, that their teams are just incredible. So that's where you want to aim to be, and just know that they're there for you and they're going to take good care of you and your baby. And that's just awesome. Obviously, while the desire is that none of this affects any of you, if you're listening here and you begin to have any of these signs and symptoms, now you know the when to head in, who you can talk to, and what to expect should you experience any of these things. Now, if you are looking for more knowledge, education, and support throughout your pregnancy and preparing for your upcoming birth, I would love if you would join me in the My Essential Birth course. If you haven't checked that out yet, it's myessentialbirth.com/get started. It takes you through all the nitty-gritty details of everything that you will learn, how you will be supported, relaxation, meditation, stages of birth, nutrition, exercise, postpartum. It's literally all there. If you ever have any questions, make sure that you shoot me an email, hello@myessentialbirth.com, or hit me up on Instagram @myessentialbirth, and I will see you next week. That's it for this week, but make sure you subscribe to the podcast so that you get notifications first as I drop a new episode every week. And don't forget to head over to myessentialbirth.com for all of the free downloads mentioned here and to join the birth course and community serving pregnant moms just like you. If you enjoyed this and other episodes, I would love it if you would take a few minutes to leave a review on Apple Podcasts. I read every single one and include one at the beginning of each episode. See you next week.